Hi, welcome to the ITSAN video podcast. Today we are joined by Rakhi Roy. She's a registered and licensed dietitian who has been through TSW and considers herself healed. She's the creator of the Gut Skin Nutritionist program, where she works with clients one-on-one, going through TSW as well as other skin-related issues. So welcome, Rakhi. So happy to have you here today.
Thank you so much for having me.
So let's get started on your TSW journey. I know you consider yourself healed. So can you tell us a little bit about, how you healed, how long you used topical steroids, how long it took you to make it through the worst part?
Yes. So hello again, my name is Rakhi Roy. I'm a clinical and private practice registered dietitian. I work with wound patients and HIV patients with compromised immune systems. So before that, I was working in the clinical space, and then I developed TSW. So now I work with skin patients solely in my practice, given my background. So I was born with eczema from 6 months of age. I had the atopic march. So I had eczema, food allergies, asthma, the whole 9 yards. I stopped using steroids in high school, and then I started using Protopic in high school and throughout college. So I actually stopped steroids for over 10 years before my TSW started. Then I went into remission with lifestyle changes, and my eczema was way more manageable throughout my early and mid 20s. And then I started presenting with TSW in my late 20s. So I did go through TSW for 3 years. And I would say, of course, now I consider myself healed. The first year of my TSW was interesting, and I still have a question mark about whether that was really truly TSW, because it was triggered after I had surgery. So I did experience the fatigue, the lethargic thoughts after, like most people with TSW experience. But then I experienced oozing. So I just didn't know if that was related to the surgery, because of course, after coming off surgery, that does impact your immune system. There is a shift. So I just thought maybe I was just having some kind of reaction to the antibiotics or the medication they put me on. I was not sure for 2 months what was going on, and I couldn't take it anymore. So then I went to the dermatologist. I did not want to be put on steroids. I got put on Eucrisa. Eucrisa was new at the time. This was around 2017. And then I was put on Singulair, so montelukast, and that actually cleared things up for me for a while. And then late 2018, I started working in the hospital, and that's when I started reaching for the hydrocortisone. And I put that on my hands because of all the excessive hand washing. And then that's when I developed red sleeves. And I was like, this is different. I've never experienced this before. And of course, I went up. I was like, hydrocortisone's not helping. Of course, my skin got addicted, and I went up to a mid-potency steroid. And that was like around my second flare. My third flare was 2020. I had an eye injury, and I used steroid eye drops. And then my full body was just covered in red. I mean, I'm melanated skin, so parts of my body were red and then parts of my body were really tan. So I realized that was post-inflammatory hyperpigmentation. So that was my journey basically from 2017 to 2020. And 2020, I started to really hone in on looking at my skin through a different lens. I know when we have eczema, we're told to moisturize, moisturize, moisturize. And I think that was not actually helping my skin. So I did do a little bit of moisturizer withdrawal. And then working with wound patients, I started to see the correlation with what their skin actually looked like, surprisingly, and it looked similar to TSW because my skin was breaking down. And so there's something that we practice in the clinical setting called moist wound healing. So as a dietitian, I'm on the team to help support calories and protein, because nutrition is important to heal skin. But then I also worked with my wound nurses, and that's when I learned about different dressings and dressing changes and what that looks like and how often you should change, which is the complete opposite of what we're told in TSW, which is like dry yourself out, don't put anything on, don't take baths. Well, I think that can be helpful maybe during the oozing stage. I started to learn if I really wanted to kick this in the butt for myself, at least in my experience, I have to give this a try. And that's what really started things healing for me.
Okay. Wow. So you had quite a journey, lots of ups and downs when you were thinking you were healed and then you weren't. And it could have been immunosuppressants that actually put you into TSW and surgery, possibly medications that you were given. So we aren't really sure what happened fully there. But it could have been a combination of all of those things.
Like I mentioned, I was on Protopic, and
Yeah.
even at that point when my TSW presented, I wasn't using Protopic that often. I probably had stopped Protopic use for almost a year. And then that's when my skin kind of started to present the oozing and the nerve zingers. So
Wow.
I think something is to be said with the immune system being suppressed and how current medical system is looking at eczema. And now it's like, unfortunately, giving these side effects from these medications that were put on.
Yeah, that's a whole other topic with all the new medications coming out that are considered to be biologic and more natural, but they're still suppressing the immune system. So it's a topic for another day, that's for sure.
Yes.
So when you started exploring healing during your journey, you mentioned you did moisture withdrawal, and then you also did something called moist wound healing. So, and these are definitely buzzwords in the TSW community. And I think it would be really interesting coming from you to, if you can just give us a brief rundown of the difference between those things, and also when one might use each one, because I feel like there are different times and places for those types of things being done. Do you agree with that? Or
I agree with that. Yes. So in the TSW community, there's obviously moisturizer withdrawal, where you just stop using all moisturizers topically on your skin to allow it to basically get back to its natural rhythms. There's also NMT, which I think personally from a professional standpoint is extreme. So NMT is no moisture treatment, where you don't just like stop topical moisturizers, but you also reduce drinking water, I believe, to less than 1 liter. So, I mean, as a dietitian, it is in my scope of practice to put people on fluid restrictions, but it's usually related to edema when it comes to chronic kidney disease. So in TSW, we don't face that. We don't have a kidney issue. It's more so a skin barrier issue. So I understand maybe where it initially started from, trying to control the fluid in the skin. Oh, just stop drinking water. But that's usually related to like your body's, how it regulates water intake and output through its kidneys. So if that's not really the issue, I think some people can teeter the danger zone by reducing fluids so much that they will be dehydrated, and that will, potentially put you in the ER. So I would say moisturizer withdrawal, I think there is definitely a time and place if your skin's really oozing. That can help. It helped me personally. I know everyone's different. I did do Dead Sea salt baths instead of showers. That really helped calm my skin down when it was like burning and itching. So that's defining those two terms. Moist wound healing is, I think, a new concept, and maybe not a lot of people know about moist wound healing. So what does that really mean? So this was actually revealed in the 1960s, believe it or not. I just don't think it's come to mainstream knowledge yet, which is so surprising. But a lot of people still believe this conception of, oh, I just need to air out my wounds. I need to air out my skin and let it dry out so it'll heal. So now I hear people say, like, I don't understand. I let my skin air out. Why isn't it healing, right? So contrary to popular belief, the skin actually heals faster in a moist environment, not a wet environment, but moist. So what that means is it's covered under slightly humid conditions to allow new healthy skin cells to essentially swim easier than having to push up against dried, hardened, scabbed skin that has been open to the air. So your skin, if this is your skin, like the top layer, your cells are swimming across the matrix towards the top. So if you have a scab forming and it's hard, you don't allow the new skin cells actually to come up as easily. And that's when you get the drying and the cracking, and also dry. So gauze is considered a dry method, because if you have ooze and the gauze sits on top of the ooze, then it's dried and it's stuck to that, and it's painful upon removal. And you don't want to just rip it off, because now the newly formed baby skin cells that were underneath come off with it, and you just re-traumatize the skin. So if you do have gauze, you have to remove it very carefully. Usually in the clinical setting, we use something like a saline wound wash. You got to wet that gauze and then remove it. But there's so much more now available with moist wound healing technology. There's different dressings. So we typically use medicinal grade Manuka honey, which is different from the Manuka honey that you eat. But I wouldn't recommend going into your kitchen pantry and putting that on your skin. It might actually aggravate the skin.
Yeah,
So
it could be a little messy too.
and messy, right? We don't want anything sticky. It'll make us even more like itchy. I actually trialed it on myself. So I was the guinea pig in this. Like, could you put that on your skin? It's a no-go. I much rather use some kind of a dressing where the foam pad is actually drenched in the Manuka honey. There's different brands out there. Some are more stickier than others. I like the ones that are not super saturated. It's more dry to the touch when you open the packaging. And then when you put it on the skin, your body's natural moisture. So we have something called natural moisturizing factors, your body's own humidity, if you will, kind of moistens the pad, and it kind of creates this nice pH balanced environment for your skin to actually heal. It's antibacterial, antimicrobial. It really allows the perfect environment for the skin to heal. Now, you wouldn't want to use this for anyone who has a fungal infection. So if you think honey, sugar, you probably wouldn't want to put it where there's like a yeasty environment. But there's other dressings that are available, like calcium alginates, there's hydrogels, there's foam pad dressings that are non-adhesive, that don't stick. I mean, there's a whole new world out there. All of this is evidence-based. There's research on this. And I'm currently trying to actually put out a abstract, so submit it to a research paper based off of my findings on case studies that I've worked with on patients, to kind of get the word out there. The research right now is only showing how moist wound healing can be applicable to bed sore patients. So people who have wounds that I worked with, of course, in the nursing homes and the hospitals, but nothing so far has been put out on TSW patients. And I'm seeing really great results by using applications. So
I can vouch for that for sure.
Yes, I want to hear a little bit more about what you experienced with your daughter.
Well, yeah, I'll go into it a little bit because maybe it'll help other people too. And I do mention it at times when I see wounds that look similar to my daughter's. But we wound up in the emergency room. And it's one other thing that I need to mention now as well. This is something that really needs medical supervision. So that's why at ITSAN, we always recommend that you hopefully you can find a TSW supportive physician, but definitely a medical practitioner who understands these types of things, especially working with open wounds. But we wound up in the emergency room, and we went through the whole story of being allergic to steroids. And I basically was just asking them for something what do they give to burn victims? Because that's basically what she looked like at the time. And also my niece worked in the emergency room, and she reiterated the fact that they used moist wound healing. I had never heard of it in my life. And they gave us these moist dressings, and they were actually moistened already, gauze pads with Vaseline. And we used those. And then we started basically making our own. And it was like a miracle, really. I have pictures and I can show people as well, but
I have pictures too. I can do a screen share of the stages.
Yes, I'll add the pictures to this when we're done for sure. Yeah, but the stages, I have a month-long, where we went, it was actually just weeks, where you can actually see the skin forming overnight. It was amazing. And we changed the dressings, and, we made sure that we were keeping it clean and so forth. So I can vouch for the moist wound healing, but again, like you said, there are different times where, moist wound healing seems to work, and then moisture withdrawal seems to work. So I know it's very confusing for people, especially, just starting their TSW journey, and they don't really know what to do. And it's a very frantic, scary time. So thank you for explaining that.
Yes. And I have to also, I try to guide my clients too when they first come to me, because most people will find me on maybe Instagram, and they'll try some things that I've mentioned, and it works for a little bit, but then it's not And then I kind of do a little bit of a patient history to try to understand what exactly they're doing. And I find they really aren't either using the right type of dressing, or the steps that they're using aren't ideal. So if you are using the dressing, for example, sometimes you want to keep it in place for 3 days or 7 days. You don't want to change it daily. Or if you are keeping it on while you're in the bath, sometimes that might macerate the skin and break it down. So that's when you would want to change it more frequently. So there's situations where it's, you want to do more frequent changes and not, and then how to clean it. So I like to tell people you want to treat it like it's a burn, right? You want to think about, what do I do when my skin is sunburnt or when it's tender? Usually you're not putting a moisturizer on it. I even found, so it's interesting that you mentioned that you put Vaseline on your daughter's skin. For me, that was very irritating. All I did was like the Dead Sea salt baths, and I did saline wound washes. And a lot of times that's what I recommend to my clients. Just clean it like it's a burn and just dress it.
We didn't purchase Vaseline. The ones that they gave us at the hospital were Vaseline. So yeah, I wouldn't use that either, but we did have something called unpetroleum jelly. And then we also used something called Egyptian magic. So that seemed to do the trick. We didn't have the Manuka honey, and I didn't even know about it. So, but yeah, that's very, very interesting.
One more thing to add to the toolkit. I mean, I'll go ahead and actually even share my own pictures of my moist wound healing journey. And this is just on my Instagram. And as you can see in the left picture, I had 1 year of this open wound on my right hand. It was so difficult for me to just do daily things in my life, like cook, clean, open a doorknob, or even drive with the steering wheel. It was just so painful. And I had 1 year of this going on. And I didn't understand why it wasn't healing. I was like, I'm airing it out. It should be healing by now. And then I started to implement moist wound healing. And as you can see, within 1 month, it already started to close. I had developed something called impetigo, which is an infection. So I should preface that with saying I put a little bit of mupirocin, so it's topical antibiotics for my dermatologist. But after the mupirocin, my skin kept cracking and it kept reopening again and oozing. So that's when I started to implement the moist wound healing. So this is what it looks like after 1 month. And then after 2 months, you can just see the pre-maturation. So I used occlusive and semi-occlusive dressings during this time. I have another slide too, if you see the stages of skin wound healing. So, the first couple weeks you're in inflammation, and then you kick into proliferation, where the skin cells start to basically lay across, the collagen lays across in the wound bed, and it strengthens, and the wound edges begin to contract. And a lot of people don't realize this, even though it's about 6 weeks for skin cells to regenerate, it can take up to 2 years for full maturation to occur. So if you're not really protecting that skin, yes, I do. That's what I see a lot in TSW. It's like, it looks like the skin is strengthened and it's strong enough. And so we start, living our life as we did pre-TSW, and you realize that maybe the skin's just not quite ready yet. The skin cells are just not quite matured. So even though I'm recovered from TSW, I still wear clothing to protect my skin, because it's still in that maturation phase. So that's something to keep in mind, because the complications are infection a lot of times if the skin's too thin. And this is just another illustration of what moist wound healing environment looks like. On the left side, it's enhanced epithelialization. So, that can be achieved with non-adhesive foam pad bandages, hydrogels, calcium alginate, Medi-Honey bandages, just to name a few. But the old way, and this is what I see happening with TSW sometimes, is regular adhesive bandages and gauze, which is a dry environment.
Okay. All right. Well, that's really helpful to see.
Yeah.
For sure. So we can find that on your Instagram page. You have those slides up. Okay.
My Instagram is gut.skin.nutritionist, and I try to do my best and condense everything into a highlight as well. So when you first pop up on there, it'll be the first thing that you should see.
Okay, excellent. Yeah, that's definitely really, really helpful, because I don't think a lot of people going through TSW feel like they have many options when it comes to healing their skin. And then the other thing we can really get into talking about is, after you feel like your TSW is healed, and then sometimes there is this very strong chance that you have some type of skin infection as opposed to the continuation of TSW.
I see that happen often, of course, because the skin barrier is no longer functioning as it once did. So you are definitely susceptible to infections, either bacterial or fungal. And with a lot of individuals I see, maybe in the initial stages, the initial shock of coming off of topical steroids or anything that suppresses the immune system, I see be like a true TSW, with the symptoms being the oozing, the burning sensation. But years down the line, if someone is flaring, I see their skin's not improving, you have to question if there's like an underlying root cause to what's driving the skin from healing. And sometimes it's a fungal infection. It can be a red, just like a lot of times in the face region and the neck, the upper chest is a lot of times what I see be fungal related. And that's an inside and outside job. So outside being, you have to protect the skin barrier at all costs with the methods we just talked about earlier. But from the inside approach, you have to realize that, if you've gone on antibiotics and antifungals, it's probably in your best interest to do things to support your gut health, because it's been decimated by some of these medications and you've lost resilience. And a lot of times you won't be able to get it back. So having a diverse, rich diet, high in fiber, and then sometimes choosing strains of probiotics that are specific for example, a fungal infection is going to be really important. There's certain strains that are out there like Saccharomyces boulardii that can be used, but understand you should be under some supervision when you are implementing some of these things, because not all probiotics are created equal. Lactobacillus acidophilus is also a great one that's been researched in this area. But again, if you're introducing new bacteria, you have to do it in a tapered step-by-step approach. Otherwise, you could also trigger a flare. There's certain probiotic strains that are histamine producers, and you don't want to drive that issue either. So there's a lot of information that's out on the internet about this, and I know it's overwhelming and confusing. But that's why I think it's really important to go to someone who knows what they're doing in this regard, at least to help guide you through when to introduce these things in and when.
Right. Yeah, that's definitely important. And it's just very disheartening. It's just scary to think that, we're going through this issue of this drug withdrawal, and then it opens a whole other, Pandora's box of, skin infections due to, suppressing your immune system for so long, or the weakened skin barrier. So there's lots of moving parts that everybody needs to really be made aware of. So again, hopefully finding a TSW supportive practitioner could help you, be guided through the journey and not do it alone, because I just remember feeling very, very alone and just searching for answers. So hopefully this type of information will help people during those times.
Yes.
So just to sum things up, so we've talked about moist wound healing. We talked about the differences between NMT and moisture withdrawal. And we talked about skin barrier support, internal support. So can we just sum it up, and talk about maybe what are the top 3 things that someone might need to do to just support their healing, and just, have a summary of these things, whether it be lifestyle changes, internal, external factors, just your basic top 3.
So number 1, seek support. You definitely don't want to do this alone. Even when I was going through TSW, during my darkest days, I just could not think straight. I had a lot of information swimming in my head, and I still wasn't able to implement anything because I was just not in my right mind. So seeking support, whether it's from family to help you with making meals, don't skip meals. I really, really encourage you to still stay on top of even the days where you don't feel like getting up out of bed or eating. You can have shakes or smoothies, some kind of liquids to kind of help give you that strength. Protein's really, really important in wound healing. I can't stress that enough with all of my clients. So getting the support that you need from friends and family. And then of course, like support professionally too. I guess it goes into my second tip that, take everything with a grain of salt when you go onto these message boards. You can get inundated with unsolicited advice. And it's really, really, I think, important to just listen to your intuition. There's just not one way of healing. You have to listen to your body and what feels right for you. Don't go down the Google research rabbit hole. I think it's great that ITSAN has a resource that basically collectively provides TSW supportive practitioners. So I would say definitely start there too. And my third tip really would be to find something that brings you joy. I think we're consumed with so much overthinking about our skin and what it's going to look like when we wake up the next morning and what the next day is going to bring, because it's so uncertain, we don't know. Finding things that bring you joy really can ground you. So for me personally, I found when I was going through TSW, I was always cold. I live in Florida, and so I would just go out in the sun, and that would warm me up. And I have a pool, so I would just like look at the water, and that's a little form of like meditation. I couldn't meditate while I was going through TSW because you're so itchy, but focusing on like the water rippling. If you're able to go for a walk, that's great. Movement's super, super important. I know we want to be bedbound, but pushing yourself a little bit if you can. For me, I was able to sweat a little bit in the sun, and that felt kind of hydrating. My natural moisturizing factors were released in that moment. And just being out in nature really helped me just focus and slow down and get outside my four walls. So yeah, just find whatever it is that brings you joy and focus on that.
That's really, really good advice. I have to remember to do that every day as well. So thank you for the reminder.
It's a work in progress for me too.
Yes. Well, I really appreciate all these wonderful gems of information, and I know it's going to definitely be helpful for people to listen to and help them during a really difficult time. So I appreciate that. And in the comments, I'll put where they can find you, your Instagram page. And I believe you're also on our practitioner list, so they can find that on our website as well. So thank you so much, Rakhi. It was always good to talk to you, and I'll talk to you soon.